Okay, guys, so today's case is varithena of. So we're just finishing up a varithena procedure here, where we injected a accessory saphenous vein. This is sclerotherapy of the leg, and essentially we have a vein. You can't see it here, but we use ultrasound and we identified it. So your doctor will put a probe like this when they're doing sclerotherapy sometimes and look for feeder veins. That's ultrasound assisted sclerotherapy versus just visual cosmetic sclerotherapy, where the doctor just looks at the leg directly by sight and injects. Now we use some alcohol to prep the skin. This is not a sterile procedure. These are semi-sterile procedures. And in this case, the cosmetic as well as pain concern was centered around this cluster of varicose veins here. And you can see I was able to find a feeder vein right in the direct center of this. And it's all now been injected with varithena, and it will get very inflamed in the next few days. Some of this will shut down. I think this is much bigger than what I normally treat. And so I think some of it will shut down with the polydocanol foam, but I don't anticipate that we're going to have 100% success all at once. I do think that we'll have to come back in a few months and do another treatment if there's anything residual that the patient is not happy about. But for the most part, this whole vein, once I injected this, you could actually see with the ultrasound all of the chemical traveling through the smaller veins. Um, can you put this right here for me? Hold the probe right here gently. And I'm just gonna move it around a little bit. Right there, you can see all this, that white stuff, and the chemical is moving back and forth throughout these veins in the leg. And so that is an example of how varithena essentially works. And now everything is going to be, all of these veins are going to be killed over a few months, and then eventually will fibrose and scar down, and then eventually just disappear over time. But it's a process.